Hi, I am Dr. Mehboob, MD Ophthalmology from AIIMS New Delhi, and today I am going to discuss the part 4 and the last part of my rapid revision series for the NEET PG. In this rapid revision, let me tell you, I am discussing 100 MCQ in 4 parts and covering the whole ophthalmology, important topics, important concepts important for the upcoming NEET PG examination. And if you have the time, just go through the topic, just go through the whole parts of this and you will be able to solve 60 to 70% of the questions in the NEET PG. It's a bet. Okay, now if you don't have so much of time, you can directly jump over the topics whose questions number is being given here. Just search this question number in the relevant part, like here we have the part 1 first 25 question, part 2 second 25 question, part 3 51 to 17, part 4 71 to 100 plus miscellaneous have been discussed. And mind it, this is also important for the FMG students also. Okay, so we are going to discuss right from 71 number question. So let me start with the 71 number question. Here is the 71 number question. The correction factor is -1 diopter for the distance 1 millimeter. What is the correction factor for the retinoscopy at 66 centimeter? It's -2, -1, -0.5, -1.5. What is your answer? Think and tell. The answer for this question is 1.5. So you have one concept that at 1 millimeter you have to subtract -1, at 66 centimeter or 2/3 meter you have to subtract -1 per diopter. So suppose if you are given this retinoscope where it is -0.5 diopter vertical and -3.5 diopter horizontal at 66 centimeter, then what is your final outcome? What will be your final outcome? It has to be -0.5. See here, -0.5 -1.5. So it will come around -3.5. So it was -3.5 and this will be -2.0. Just we are subtracting -1.5 from here. So what we are getting? We are getting this type of retinoscopy final. So you understand my point. Let me tell you few examples of this. 1 millimeter -1, you already know √3 meter, that is -1.5. Now for atropine, how much you subtract for atropine? You have to subtract -1 diopter. You have to subtract -1 diopter for the atropine. Okay, -1 diopter for the atropine. For the cyclopentolate, -1.75, and for the home atropine, it is half of the atropine. It is home atropine, that is half of the atropine. So remember, 1 diopter ka half, that is half of the atropine, that is 0.5 diopter. So this is very important question because sometimes you may be mistaken about this condition. Okay, now what is the diameter of the pinhole? Let me tell you one thing. What is the diameter of the pinhole? Pinhole diameter is 1.2 millimeter. So pinhole diameter is 1.2 millimeter. Okay, this is very important to understand this point. Okay, what is the retinoscope that you are using? Is a self-illuminated retinoscope. Okay, so you have to understand this fact. Let me jump on to the another question where you will understand better about this. On performing retinoscopy, the question is saying that on performing retinoscopy using the plane mirroring, patient who has a refractive error of -3 diopter sphere and -2 diopter cylindrical, -3 diopter sphere and -2 diopter cylindrical at 90 degree from a distance of 1 meter, the reflex would move. What do you think? Let me represent this. It's a -3 diopter, so what we can write? -3 diopter is spherical. -3 diopter is spherical. We can write -3 diopter is spherical. -2 diopter cylindrical at 90 degree. So this is the prescription of this above statement. So what do you think? What is this condition? What do you think? What is this condition? This condition, obviously the patient is having simple, just remember one thing. We can write this prescription in another form also. So the other form of this is that this process is called transposition. Writing the one form of the prescription into the other form, that is called transposition. So we can transposition. If you transposition, then how to write this? Let me clearly write here. Then what to write here? that the spherical, what is the spherical of the new prescription? The spherical will be -3, -2, add this -3 to this -2. Then what we are getting? -5 diopter spherical. So -5 diopter spherical कहाँ से आया? By adding -3 to -2 diopter. And what will be the cylindrical power? The cylindrical power, just change the sign of this. The sign will be changed -2 to -2 to -2 sign is changed to the +2 diopter cylindrical. And what is the axis will be? It is 90. Now the axis of the new prescription will be 180 degree. Now see both the thing. Can you see both the thing? Just remember, if you want to know whether the retinoscope or this prescription is myopic prescription or whether the prescription is hypermetropic prescription, you have to see only the spherical power. Okay, since the power of this is -3 and this is also minus, and both of them, it is 3, it is 5, since it is different, power is different, spherical power of this and this is different, and the sign is minus, so it is compound myopia. So what will be? It will be compound myopia. Now remember one important thing, that if you want to see whether it is with the rule astigmatism or against the rule astigmatism, for astigmatism it is very clearly understood that for astigmatism you have to see only cylindrical axis and the sign of cylinder. Cylindrical axis and the sign of cylinder. Remember this fact. Remember, see here. Plus cylindrical at 90 is with the rule. Plus cylindrical at 90 is with the rule. Means minus cylindrical at 90 will be against the rule. Since plus cylindrical at 90 is with the rule, so plus cylindrical at 180 will be against the rule. Right? Now you here see, it is minus cylindrical at 90, so it will be against the rule. Now you have to consider that in the retinoscopy, prescription is this, means we have diagnosed this patient as compound myopia against the rule. Compound myopia against the rule astigmatism, simple. I will tell you in the latter part also. So it is compound myopia. Now on retinoscopy, with the movement in both axes, against the movement in both axes, with the movement in the horizontal axis and against the movement vertical. This is, now let me tell you this one. If it is moving against the motion, this retinoscopy is move against motion, it is myopia of more than 1 diopter, means more than -1. If it is with, it is hypermetropia or myopia of less than 1 diopter. It is if it is moving against the motion, myopia of more than 1 diopter. If it is moving with the motion, it is hypermetropia or myopia of less than 1 diopter. And if it is neutral, then you have either emmetropia or myopia of 1 diopter. If it is neutral, you have emmetropia or myopia of 1 diopter. Now see, since in the previous question, the question is compound myopia, that is myopia, obviously it will move against the motion, so our answer will be against the motion, right? This one will be the answer. Very simple. Now let me give you one example, one question. I have told you about all these things, retinoscopy, retinoscopy, okay? Just remember about the retinoscopy 2 to 3 things. Just remember about the retinoscopy. If you are given this retinoscopy like -5 or -3, then why it is with the rule or against the rule? For with the rule, when we say with the rule, when the vertical axis is more than horizontal steep. When the steepness of vertical axis is more than horizontal, then we say again with the rule. और against the rule कब बोलेंगे? When the horizontal is more than vertical steep. Steepness of horizontal axis, this axis is more than the vertical axis. Steepness, it is more curved. Then it is against the rule. तो simple सी बात है. And one important thing, more the negative, more negative. Remember, more negative, more steep. Now more negative, more steep. More negative, more negative, more steep means more negative. In this photo, which is more negative? -5 is more negative than -3. So this vertical axis is more curved than the horizontal axis. Vertical axis is more curved than the horizontal axis, so it is with the rule. So the option answer is with the rule for this. Suppose we have the formula of +3 and this is +5 and +3. Then +3 is more towards negative than +5. +3 is more towards negative, right? So it is horizontal axis is more steeper than the vertical. Horizontal axis more steeper than the vertical, so against the rule. So this is against the rule. Okay, so this way you understand this fact. Now if you are given the prescription like in the previous one, this one, suppose this was the question, so you have to understand this, that the plus at 90, if there is a plus at 90, it is with the rule. If there is a plus, vice versa, plus at 180 degree against the rule, minus at 90 will be against the rule. Just remember this and just start vice versing the thing. So it is minus cylindrical at 90, see, that's why it was against the rule now. So this is important. Now second thing, that if you do this transposition, I have told you the transposition how to do. If just see the sphere, if one of the spherical power is -3 or something and the other spherical is 0, okay, suppose let me tell you, suppose one power is -3 diopter spherical, -3 diopter spherical, it means suppose one is -3 diopter spherical minus +2 diopter cylindrical at 90 degree, and इसका if you do the transposition of this का transposition करेंगे तो क्या होगा, -3 + 2 कितना हुआ, -1 diopter sphere. Just change the sign of the cylinder, -2 diopter cylinder, and change this axis to 180. So see, it is plus at 90, so with the rule astigmatis, right? Similarly, it is minus at 180, simple, with the rule astigmatis, just vice versa the thing. Now since it is -3 diopter and it is -1 diopter, then this is compound myopia, because both the sign is same, it is myopia, and the value is different, it is compound. If suppose this is 0, if suppose this comes 0, one is 0 and another is something, then it is simple myopia. यहाँ प्लस साइन होगा तो इट इज, यहाँ दोनों में प्लस साइन हो जाएगा तो इट इज कंपाउंड हाइपरमेट्रोपिया, और अगर एक में प्लस साइन है और दूसरे में 0 है, then it is simple hypermetropia. So this is the concept of the myopia and the different type of thing. I hope you remember all these things, because this was a very vast concept, easily asked in the examination. That's why I have explained it, giving the time to this question. Now the reciprocal inhibition of the antagonist muscle is explained by reciprocal inhibition, Herring's, Hicks, Laplace, Sherrington's. The answer, very simple, the answer is Sherrington's law. It is the reciprocal inhibition. This is reciprocal inhibition of the antagonist muscle. And what is this Herring's law? Herring's law states the synergistic muscles. Okay, it talks about the yoke muscle. Okay, suppose this is the right eye, suppose this is the left eye, right? Then this is what? This is MR and this is inferior oblique, this is superior oblique, this is superior rectus, this is inferior rectus. Similarly, this is inferior oblique, this is superior oblique, this is superior rectus, this is inferior rectus, and this is LR, and this is lateral rectus. So remember, this one is yoke muscle of this one, this one is yoke muscle of this one, this IO of right is yoke muscles of this, IO of SO of left is yoke muscle of this. So you can be asked, just remember this photo. If you don't have, just go to the book or something, net vagara, just remember this photo. This is very important to understand because yoke muscles can be asked in the examination, remember. So obviously Herring's law states the motor correspondence, states that the binocular movement, the corresponding muscles receive equal and simultaneous innervation, means synergistic muscles, yoke muscles. Sherrington's law of reciprocal inhibition for any binocular movement, antagonist receives equal and simultaneous inhibition. Coming to the 74 number question, limitation of both abduction and adduction is seen in. Agar DRS is a thing, whenever you are going to adduct your eye, there is a constriction of, or this palpable aperture becomes small, then you diagnose it as a DRS. But there are the different types of the DRS, 1, 2 and 3, and for that you need to remember all these things. 1, 2 and 3. This is type 2, the question is lacking 2. This is 2. So what is the answer? If there is a limitation of abduction and adduction both, then the answer will be, remember, type 3. Just don't go into detail, just remember all these things. Let me tell you, see here, there is an abduction, and in this one there is only abduction, ABD only abduction limitation. Okay, in the type 2 there is an abduction normal, only abduction limited with retraction. Here abduction normally, abduction limited, okay, and abduction also limited because of restriction. Here there is an abduction limited, abduction is normal usually, but when there is a retraction, then there is a limitation. And here remember this fact that the abduction and adduction, both of them are with retraction, both of them are limited with retraction. It is normally limited, abduction normally limited, and also limited with retraction, no adduction limitations. Abduction is normal but limited with retraction. Here both the abduction and adduction are abnormal with retraction. This is very important point. Now in AV pattern, this you have to remember this. I will show you how to make this type of long and lengthy question easily. In AV pattern squint, which of the following is wrong? The term A or V pattern squint are labeled when the amount of deviation in squinting eye varies by more than 10 degree and 15 degree respectively between upward and the downward gaze. Okay, suppose that this is the patient, normal patient, this is a primary gaze, right? Patient is seeing straight. ठीक है, patient is seeing straight. Now we ask the patient to see up. We ask the patient is seeing up. The patient is seeing like this. Means the eye का cornea यहाँ पे आ गया. This is the, suppose this is cornea. Okay, now we ask the patient to see this. So the thing is that whenever you ask the patient to up and down, you have to assess the deviation. If the deviation is, whether it is exo, iso, don't go into such details because it is beyond your scope. Remember, if we ask we assess the patient in the different 9 gauges. For AV pattern, you just remember, we ask the patient to see up and down and straight. Okay, whether it is exo, iso, doesn't matter. Just remember, if the eye in upward direction, if it is 10 degree, then it is, and there is a pattern like eye is going like this, like this, the eye is going like this or like this, there is a measurement instruments there. But remember, if the eye is going like this and this, means there is a measurement like this. If the eye is moving like this is A. If the eye is seems to move like this is V. This is A, this is V. If for A to happen, there have to be a difference of 10 degree, and for V to happen, there have to be a difference of 15 degree. Just remember this. Don't go into the details. You will not be able to cross this because this is beyond the limitation, and this is highly complex thing. So remember, we see the patient in the different 9 gauges, but for A and V pattern, we ask the patient to look straight, above and down. If it seems that the eye is going like this, there is a A pattern. If it seems that their eye is going like this, there is a V pattern. Okay. And for A pattern, the parameter of the deviation should be more than 10, and for the V pattern, the parameter of deviation should be more than 15. 10 and 15. A for 10, V for 15. This is all you need to know. So we come to the knowledge that the term this one is a true statement. Now again read this one statement. The term, read this statement that a term A or V pattern squint are labeled when the amount of the deviation squint varies more than 20 and 25 degrees. This is wrong, because I have already told you it is 10 and 15, not 20 and itna. So in A it is 10 degree, in V it is 15 degree, right? So this is the answer of it, because we have to find the wrong. So just answer this very carefully. Usually overaction of the inferior oblique or weakness of the superior oblique or weakness of the superior oblique leads to the V pattern, and overaction of the superior oblique और weakness of the inferior oblique muscle dysfunction. देखो ये सारी चीजें जो होती है, it will make you very complex thing. Just what I have told you, just remember this, because if you go into such a detail, now you will get confused. I can tell you, but this is beyond the limitation, beyond the scope of this rapid revision. Okay, I will tell you in advance. I will tell you the concept in the separate class, but not here. Remember what I have told you. This is a trick. Coming to the 76th question, what does the picture in the test indicate? Just look at the picture. The patient is seeing in the primary gaze, right? On covering, the eye deviates toward the exo deviation. Eye deviates to the exo side, means eye deviates outward. But on uncovering, again there is a refixation. It comes back to the normal position. What does this test indicate? What does this test indicate? Whether it is a cover-uncover test indicating exophoria, whether it is cover and uncover test indicating esophoria, alternate cover test indicating esotropia, alternate cover test indicating exotropia. Alternate means what? First we cover this, then we should cover this, then it should be alternative. Alternate का मतलब यही होता ना कि पहले इसको कवर किया and then फिर इसको कवर किया. But यहाँ पे only we are covering this and thus uncovering. So it's obviously a cover uncover test, right? So we rule out this option C and option D. Now we are left with option A and option D. B. Phoria means hidden. Phoria means hidden. Remember, phoria means hidden or latent. And tropia means manifest. Phoria means hidden. So since this deviation is hidden and can only manifest when covering, so it is phoria. And since it moves outward, it is exophoria. So our answer will be A. Cover uncover test indicating exophoria. Now let me tell you the two most important thing that is very important. What is this test? This is the Worth 4 dot test. This is not the normal thing. Normal thing is that it should be red and यहाँ पे एक white होता है, या white होता है. But the patient is seeing this one, wearing the red green glass. Patient is wearing the red green glass and patient can see this red For right eye, green for left eye. Patient can see only green. Means there is a separation of red. So it is red separation. So it is what? Red separation. Red separation means right eye separation. Right eye. Red separation means right eye separation. Now you have to remember this. What is this test called? Bagolini's test. This is called Bagolini's test. Bagolini's test. For and using क्या? Red green glass. Bagolini's test, we are using the red green glass. This is all about this condition. Now coming to the next question. The clinical photograph. Let me tell you the clinical photograph. This patient is clinical photograph. What is the photograph with and without glass? This is without glass. This is with glass. What should be the probable diagnosis? Infantile exotropia, accommodative exotropia, intermittent exotropia, Duane's retraction syndrome. देखो भाई, patient is having here manifested what? Esotropia, because it is inward and it is manifested. So it is eso and manifest, then tropia. So it is esotropia. Now on glass, the esotropia gets corrected. Means what? On using the glasses it corrected. Means the patient is hyper converging with this right eye, hyper accommodating with this right eye, and the patient usually is suffering from what? Hypermetropia, hypermetropia or myopia. The patient is usually suffering from hypermetropia. So ये patient को क्या होगा? कौन सा refractive error है? Hypermetropia. So this can also be a question. And since because of this hypermetropia, patient is unable to see the near object, and that's why he is accommodating more. So the answer will be accommodative esotropia. Infantile esotropia cannot be corrected by this. Exotropia cannot be the answer because it is esotropia, it is inward. Duane's retraction syndrome, when the patient is asked to see adduct, there has to be lid contraction. Okay, there has to be lid contraction. The palpebral aperture should be decreased, but here there is no decreasement. So answer is very clearly accommodative esotropia. Now what is this? What is this indicating? I am not just telling you about the things that what is this? Tell me. What is being done? Suppose this eye is having a vision of 6/12 or 6/18 since childhood, and it is 3-year-old child. Since 18. So this is what we are doing. We are patching the normal eye, and this therapy is called amblyopia therapy. And what is this test? This is called Titmus fly test. Red green glass is being used and Titmus fly test is there. So this is about this condition. Now coming to the next question. Which of the following is self tonometer? Self tonometer means patient can itself measure his IOP, intraocular pressure. Rebound tonometer, Perkins tonometer, diatom palpebral tonometer, dynamic contour tonometer. Which is this? Tell me. So patient can do, the answer is very simple, rebound tonometer. It is, or the examples are eye care tonometer, or this one is eye care tonometer is the rebound tonometer. Perkins tonometer is usually used in the child and can be done in the supine position. So comatose patient में भी कर सकते हैं. Patient in a coma, we can do the Perkins. Dynamic contour tonometer is a very digitalized tonometer where the principle is almost like that of the Goldman type, like in the Goldman type, that's invert Fick principle. So we are using this. Now what is the principle of Goldman tonometer? It is invert Fick's law, that is P is equal to F by A. So this is what we call the invert Fick principle. Remember this. Now what is this? Which instrument is this? This is nothing but this is Perkins tonometer. What is this? This is nothing but this is NCT, means non-contact tonometer, and the advantage of non-contact tonometer is that it can be used in a screening because no touching, no cross infection is, and large number of patients can be done at one time. What is this? This is called the pneumotonometer. This is the picture which is most typically asked in the examination. This is the prism. This is what we call a prism, and this is Goldman tonometry. This is Goldman tonometry, right? And the area is important. Area 3.06 millimeter square. 3.06 millimeter. So this is the example oftenly asked in the examination. What is this? ये टोनोपेन होता है. Let just remember this tonopen. It is written here tonopen. One electronic transducer rubber type thing is fitted here for every patient, and we just touch it digitally to the cornea. They give a reading here, and it is very important that if there is an irregular cornea also, it can pick, because it does not depend upon the contour of the cornea. What is this? This is what we call the rebound tonometer. This is what we call the rebound tonometer. Now, what is this? This is the dynamic contour tonometer. Dynamic contour tonometer. And what is this? This is called ORA. Ocular response analyzer. Let me write ocular response analyzer. Sorry for the handwriting, but this is all the tonometer that can be asked in the examination. Now coming to the 79 question, Schwalbe's line represents what? This is a very simple and slot question. A junction of the bulbar and the palpebral conjunctiva, junction of the coronal retina, termination of the Descemet membrane of the cornea, upper limit of the macula can be asked. Very important. So the answer for this question is, it is the termination of Descemet's membrane of the cornea. Let me tell you, this is what Schwalbe's line, and this is, so if this is the Schwalbe's line, 1 minute. If this is Schwalbe's line, then this is the iridocorneal angle, this is iris, this is cornea, the angle is called iridocorneal angle. This angle is seen by the gonioscopy. By gonioscopy से ये देखते हैं. Now we have one important thing. What is the critical angle of the gonioscopy? Critical angle of gonio, anyone can tell me? It is 46 degree. 46 degree. It is 46 degree. Critical angle is 46 degree, can be asked in the examination. And what is this? What is this? This is Goldman 3 mirror for the gonioscopy. This is Goldman 3 mirror, 1 mirror, 2 mirror, 3 mirror. It is 57 degree, it is 59 degree, it is 59 degree, it is 67 degree, it is 73 degree. So you need not remember this angle degree, but remember this is the coordinate Goldman 3 element. Descemet's membrane breach in is seen in which condition we call the Descemet's membrane breach? Ophthalmos, open angle glaucoma, angle closure glaucoma, acute iridocyte. This is the sure short and the straightforward question, and the answer will be the ophthalmos. In the ophthalmos, there is a large cornea, there is the cloudy cornea, and the patient having the IOP is very high. The treatment of choice for the ophthalmos is trabeculectomy plus trabeculotomy. It's a combined surgery. Now, when they were you can get the question over the congenital opacities. The patient, a child, a newborn, born with a congenital opacity, born with a corneal opacity, and they will give the different scenario. You have to remember only in this line. Just stump, very famous. As for sclerocornea, T for tears in Descemet membrane, it can be trauma and it can be ophthalmos. So tear in Descemet membrane can be trauma and can be ophthalmos. U for ulcer, mucopolysaccharide, Peters anomaly, edema or dermoid. So you have to think in this line only. Now this is what with a typical picture that they can give you about the ophthalmos. And remember, in the last NEET PG, this question was asked. So this is very important. Treatment of choice, trabeculectomy combined with the trabeculotomy is the treatment of the choice. Moving to the next question. All are true about the angle closure glaucoma. There are the different types of the glaucoma. It can be open angle, it can be closed angle, it can be normal tension glaucoma, or it can be ocular hypertension. So they are all the different scenarios. But when there is angle closure glaucoma, means the angle, iridocorneal angle, what I have talked to you about, this iridocorneal angle is quite narrow. And how do you assess this? By the gonioscopy. Or if you don't have gonioscopy, just remember there is a shallow anterior chamber is manifested towards the angle closure and is a risk factor for the angle closure glaucoma, right? So what will be the answer for this question? All are true. Vertically oval mid-dilated pupil, multiple iris nodule, edematous cornea, edematous and hyperemic optic disc. Tell me. See, vertically oval mid-dilated pupil is a feature of this one. Remember this. Edematous cornea. किसी भी glaucoma में, any glaucoma will have edema over the cornea because of increased IOP. And that's why you see the colored halos because of the edema, and that's why you have to differentiate with the acute condition of the acute congestive, you have to differentiate with the conjunctivitis like that's why there is a colored halos in the glaucoma and you have to differentiate it. Okay, so what test you do? Stenopic slit test to differentiate it. Okay, this is very important. Now, multiple iris nodule can never be present. It has nothing to do with this angle closure. So, answer for this question is multiple iris nodule. So, what is the grading? If you go for the angle, that like I have showed you the angle, which grading system that we are using? It can be an important question. That is Safford's grading system that we are using. When we call it it is ocular hypertension, OHT, ocular hypertension. When the pressure is 21 mm Hg, more than 21 mm Hg, but there is no optic nerve head change or no nerve fiber layer changes, ganglion cell layer changes, then it is ocular hypertension. Normal tension, NTC means normal tension glaucoma. When the IOP is less than 21, IOP is not high. When the IOP is not high, but there is a change in the optic disc, there is a change in the visual field, then we call it a normal tension glaucoma. Coming to the next question, please. Okay, 82 number question is suggesting that a 50-year-old female pregnant with a history of the severe pain, redness, diminution of the vision,